Hi everyone, Namaskar दोस्तों. I'm Rachna. I am also a mother to a child.
जो जर्नी शायद आप चल रहे हैं वो जर्नी मैं भी पार कर रही हूँ और कर चुकी हूँ। कुछ चैलेंजेस खत्म हो चुके हैं। तो उस जर्नी में जो मैंने चैलेंजेस पार करे, जो मेरा एक्सपीरियंस रहा, जो मैंने नॉलेज इकट्ठी करी, राइट, एज अ पेरेंट जिसने घर पे अपने बच्चे के साथ काम किया और फिर अच्छे रिजल्ट्स जब मिलने लगे, राइट। तो वो जो रिजल्ट्स मुझे मिले और जो स्ट्रैटेजीज से मिले, वो स्ट्रैटेजीज मैं आपके साथ शेयर करने के लिए फेसबुक लाइव पे आती हूँ, राइट। तो आज का टॉपिक बड़ा ही इंटरेस्टिंग टॉपिक है और इंटरेस्टिंग ही नहीं, बहुत ज्यादा जो मेन फोकस ऑफ ऑल द पेरेंट्स जिनके बच्चे ऑटिज्म स्पेक्ट्रम पे हैं या पीड़ित हैं, राइट। तो सबसे ज्यादा हम सबके लिए जरूरी होता है कि हमारे बच्चे बोल पाए, राइट। तो हमारे बच्चे बोल पाए, ये तो एक हमारा बहुत ही इम्पोर्टेंट और सबसे इम्पोर्टेंट मकसद रहता है, राइट। दिस इज आवर गोल दैट आवर चाइल्ड शुड स्टार्ट टॉकिंग। बट अगर वो नॉन वर्बल है, राइट, तो कैसे हम अपने बच्चे को कम्युनिकेट करना सिखाएं। अब वो कम्युनिकेशन जो होती है वो मोर देन वर्ड्स है, राइट। किसी चीज को पॉइंट कर पाना, आंखों नजरों से नजरें मिलाना, राइट, बॉडी गेस्टर्स, जैसे मैं अभी अपना हैंड यूज कर रही हूँ, दैट ऑल्सो इज अ पार्ट ऑफ कम्युनिकेशन, है ना। एक होता है जो हम शब्दों से बयान करते हैं, एक जो बिना शब्दों के भी बयान कर सकते हैं, स्पेशली व्हेन इट कम्स टू कम्युनिकेशन, ठीक है। अब बहुत सारे बच्चे हमारे ऐसे बच्चे हैं जो स्पेक्ट्रम पे होने के कारण बोल नहीं पाते, दे आर नॉन वर्बल, ठीक है। अब uh, जब my child is, when my child is diagnosed with autism spectrum and my child is still non-verbal, what should be my first step to make the child or help the child to be able to communicate? अब इसके लिए हमें दो फिजिकल कंडीशंस हैं जो हमें जिसका टेस्ट करवाना है डॉक्टर से, और वो है क्या बच्चा मेरा सुन पा रहा है, राइट, इज द हियरिंग okay, I mean, is the child able to hear what we are talking? Because that might be a physical condition. वो एक टेस्ट होता है, बेरा टेस्ट, ठीक है। वो टेस्ट हम करा सकते हैं and then we come to know whether the child is able to hear. That is the first thing. Sometimes the child is able to hear but is still not able to produce sound, right? There can be a problem with the tongue as well. कभी कभी टंग टाई होता है, कुछ बच्चों में टंग टाई होता है वेयर द टंग इज कनेक्टेड टू द लोअर पार्ट, उसका जो कनेक्शन है वो थोड़ा लॉन्ग रहता है, ठीक है। एंड दैट कैन बी ऑल्सो डेल्ट विद द ट्रीटमेंट, ठीक है। अगर ये दोनों कंडीशंस का क्लैरिटी है और हमें पता है हमारा बच्चा सुन पा रहा है, हमें पता है हमारा जो बच्चा है उसकी टंग टाई नहीं है, ठीक है, और वो स्पेक्ट्रम पे है, और अब मुझे उसको वर्ब नॉन वर्बल से वर्बल करना है। आई वॉन्ट द स्पीच प्रोडक्शन फॉर माई चाइल्ड एंड and so that the child is able to speak with us, express their feelings, tell us what they need, how they're feeling, right? तो ये सब जब हम जान लेते हैं कि ओके फिजिकल कंडीशन एब्सेंट है but the child is on the spectrum, so what is the prerequisite to start the communication? Now communication does not involve production of speech. Communication can be pointing to things, right, pointing to the visual cards, right, जैसे कि हमारे पास फ्लैश कार्ड्स हैं, उसको पॉइंट कर पाना, या एक्शन से अपना नीड को बता पाना, दैट इज ऑल कम्युनिकेशन, राइट। सो अब ये जो प्रीरिक्विजिट है वो कैसे आएगी, उसके जो एक दो चीज होती है, एक वर्बल कम्युनिकेशन, एक नॉन वर्बल कम्युनिकेशन, ठीक है। सो नॉन वर्बल कम्युनिकेशन आई एम जस्ट टॉकिंग अबाउट, दैट इज अ प्रीरिक्विजिट फॉर द वर्बल कम्युनिकेशन। और भी क्या, एक प्री स्पीच, मतलब एक बच्चे को रेडी कर रहे हैं स्पीच के लिए, उसके लिए क्या रिक्विजिट्स हैं? लैंग्वेज रिसेप्शन, लैंग्वेज बच्चे को समझ में आना चाहिए कि व्हाट इज व्हाट, राइट? उस क्या वो जो भी हम बात कर रहे हैं क्या वो समझ पा रहा है, राइट? अब वो समझने के लिए वी हैव टू डेवलप देयर लैंग्वेज, एंड फॉर दैट व्हाट इज द प्रीरिक्विजिट? द चाइल्ड शुड हैव अ सिटिंग टॉलरेंस. If the child is hyperactive, we are not able to make a bond with the child, right? And making a bond is the first thing of reaching out and trying to put your word across to them, right? So it is basically that we need to make a bond, right, with the child, and then we are going to bridge the non-verbal and verbal side of our children. So uske liye, very important, the child should be able to, first of all, we need to bond with the child and then make sure that the child starts tolerating to sit without running away, right? Sitting उसकी जो capacity है, sitting behavior has to be developed before we rush to the speech therapist, before we rush to anything. Yes, first we start managing his or her behavior, right? It can be just sitting tolerance, right? Then after we have achieved the sitting behavior, then we start understanding their non-verbal cues, right? There are many, they do tantrums for various things. It might be a desire unmet, right? It might be an escape for a certain activity which we are asking. So we need to start understanding the small little signs that the child is giving, because the child might be just crying for the fact that there is an unmet need. Maybe I just need a toy, maybe I'm just hungry, right? That's the behavior. And you start, when you start observing your child, you start getting to know वो क्यों रो रहा है बच्चा, राइट? वो टैंट्रम भी क्यों थ्रो कर रहा है, कुछ चाहिए होगा, राइट, जो वो एक्सप्रेस नहीं कर पा रहा, राइट? देन वी गेट टू नो मोर ऑफ द चाइल्ड्स नॉन वर्बल क्यूज जो हमें वो दे रहा है, राइट? तो इट्स वेरी इंपॉर्टेंट कि हम जो है बच्चे का बिहेवियर, पहले तो बिहेवियर समझ लें, हर बिहेवियर के पीछे उसका कॉन्टेक्स्ट क्या है, राइट? और उसकी, बिकॉज उसकी कम्युनिकेशन डिफिकल्टीज के कारण वो बिहेवियर में जा रहा है. सो once we start understanding the context of the behavior will come down. Once it is coming down, we now know how to direct. So first, what we do, we first make a connection, then we do a direction, and then comes the correction, right? And what is that direction? How do we give direction to our children? We give direction to our children by role playing. Role playing, yes. So we can do a role play with any of their sibling or husband, wife, or with the child also, right? If the child is trying to reach a glass of water, right, you hold it, and before you give the water to the child, one word, 3-time repetition. So it's one word, 3-time repetition. You say water, 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 give it to the child. Or it's a juice that the child is going to. So just, there's a glass of juice there and the child is trying to reach without communicating with you, but now you come in between, control it. And now when you're handing out juice, you say juice, juice, here, have your juice, right? So you are actually labeling whatever the child is trying to reach out, right? So that becomes mode of, it's also about learning language, receptive language, right? Maybe they are not able to produce speech right now, but they are able to, they're able to label the item. And it's how to know whether they are able to label it correctly. You can have a glass of juice, you can have a glass of milk, you can have a glass of water, and you can tell, you can ask the child, hey baby, tell me which one of this is a juice, and the child is able to just touch, not even point, just touch on the juice. Done. That means we have put across the thing, and the child can recognize from different glasses this is the glass of my juice, right? And that's how you come to know that the language is getting developed, right? So the prerequisite is the behavior control, that is the sitting tolerance. Then comes the role play that we do with the child or with anybody else, right? And you can have your another child or a sibling or a parents or grandparents. You can just do role model. So when I'm handing over a glass of water to say, a Ranak's dad, then I say water, water, Papa, have your water, right? That's how. So, and he's looking there, he's sitting there, and we are doing a role play. And we can do, and he can also have his turn coming. And now we know that this is how he has to ask, right? So, role play is very important in making them to understand the language. Then, the prerequisite for speech development is very important that the child starts, that eye contact should come. That comes with the, sitting capacity, doing certain games where the child is to look at you even for a brief second, right? Then comes the imitation. Imitation skills is very important. Now, imitation सिर्फ voice का नहीं होने वाला. जो हम copy करते हैं, वो सिर्फ voice का नहीं है, वो हमारा physical actions भी हो सकते हैं, right? It can be just, do this or do this or do this, or you just touch your head or you touch your chin, right? So you're not giving verbal prompt. You're doing do this, do this. So you are touching your chest, your chin, your cheek, your ears, but you're not using verbal prompt. But the child is still able to copy you. This is a physical imitation, right? Now, when the child is able to imitate your physical actions, the child should be able to imitate your actions with the object. So you take a car or a train which they love to play with. You move it up and down, right? And the child needs to do the same. Or you stir in the glass, or you make sound with the spoon and the glass, right? So that kind of imitation with the objects also. So once this imitation is achieved, the language has grown. The child has sitting capacity. Then comes the role of trying to get to the speech, right? And still, after doing all that work, like at least the communication came. There was language, understanding came. If we tell them to follow a little bit of instruction, which can be do this. It's a very simple instruction, and the child is followed through. That means the child has started getting something that we call as a receptive language, right? From reception, we will move to expressive, right? Expressive is when the child start using the speech, right? So till such time the child has not able to come up with the proper production of speech, it's very important to give our children some mode of communication, right? And that communication can be picture exchange communication, right? Or it can be a sign language, right? Now, this sign language, whatever are the actions for, you can use the hands for expressing things, and it can be modified according to the what you call the fine motor skills or the gross motor skills of the child. So many a time that runner cannot use his fingers separately, they would just modify, his the actions for a particular word, right? So that he's able to tell when he's hungry, when he's so for hungry it was just touching his tummy, while for the sign language the sign is different. But for Ranak we had made certain changes, so that sign language also gives a very good way of communication, because in sign language I am not dependent on a device or I'm not dependent on the flashcards, but I can use my body parts to express what I need. So sign language work very well with Rana. In sign language also, when we would understand what he's trying to say, we would repeat that word. We only taught that word in sign to Rana, but when he's signing for certain thing, so for hungry we had given this, and for water we had given this kind of a sign for Rana. It was all modified for him because the way he could use his fingers. So we would repeat those words, one word 3 times, so that word gets into his head properly, right? It is there, but we are also giving a sound feedback. Okay, if our lips are moving, our voice is coming out. So all those we used to do. Then there is another mode of communication, which is a picture exchange, which you need to carry a lot of flashcards. You are teaching everything on the flashcards, and you carry those flashcards with you all the time. Now that becomes very cumbersome. So there is something called augmented and alternative communication devices, which can be just an app on your mobile or a tablet, where everything, all the words are there, all the flashcards, it's like the flashcards prepared on digital. It's on the digital media, and the child carries the device along to be able to produce the sound with the help of the device, right? Now, some people think that if we are going to give this kind of, if we start telling the child or teaching the child sign language, or they start using the AAC device, as it is called, our child will not work hard to produce speech, right? They will feel that their work is done and I don't need to make an effort for the speech production, right? While I think it's just a myth, I have seen Ranak from transition from understanding reception, language growth, imitation skills coming. So these were the steps where Ranak was worked upon, and he started picking up receptive language pretty fast. Then came his imitation, which was nil. It was completely zero. बिल्कुल भी नहीं वो इमिटेट करता था, ना ही वो हमारी आंखों में आंखें डाल के देखता था, ना ही हम अगर कहीं पॉइंट कर रहे हैं तो हमारी फिंगर पॉइंटिंग की तरफ भी वो नहीं दिखता था. सो जिसको हम बोलते हैं जॉइंट अटेंशन, वो भी नहीं था. बट व्हेन वी स्टार्टेड वर्किंग विद हिम, तो लैंग्वेज आने लगा. बिकॉज लैंग्वेज, रिसेप्टिव लैंग्वेज इंप्रूव होने लगा, देन ही कुड कनेक्ट विद अस, राइट? हम क्या बात कर रहे हैं, किधर पॉइंट कर रहे हैं, एंड इमिटेशन स्किल्स केम. Along with that, we also we taught him sign language. ठीक है, sign language में one word 3 times repetition करते थे, and it started happening. So when the speech came for Anna, what exactly happened was that he used to do the signing also and used to use the word also, and slowly that also faded off, right? Like for home, let's go home. So he would just do this, and he would say, "Mama." When he started speaking, he said, "Let's go home," and he will do this also, sign also. And slowly that also finished. But what was the purpose of giving him some communication tool beforehand? Was to reduce the anxiety, was to tell, so that he should able to come and tell Mama, I am hungry, I am thirsty, I want to play, I want to go home, I want to, I'm tired. So all those things were required to reduce the anxiety. बात छोटी सी होती है और बच्चा मेल्टडाउन में या टेंट्रम में चला गया, ठीक है, मम्मा मुझे भूख लगी थी, बस यही बोलना था, ठीक है, और उसका बोलने का तरीका सिर्फ रोना. एंड द मदर एंड एवरीबडी, ऑल द केयर गिवर्स आर pretty tensed कि why the child is crying. It's only because it is hungry. Yeah. Sometimes children can be feeling discomfort also, pain in the body. So all these important things we need to teach them. राइट? अगर वो कोई भी टूल नहीं है उनका उनसे बात करने का, वो अपने अंदर की बात हमें कैसे बता पाएंगे, राइट? अच्छा, और स्पीच में जैसे मैं आपको बोली ना, प्री स्पीच हमारे को बच्चे को रेडी करना है स्पीच के लिए, उसके लिए एक और चीज की तरफ अपना ध्यान डालना है, वो ध्यान हमने डालना है कि वो बच्चा फीडिंग कैसे कर रहा है, राइट। उसका ओरल मोटर में वो क्या अपने मुंह को, जैसे हम स्पिट कर पाते हैं, जैसे हम सक कर पाते हैं फ्रॉम द स्ट्रॉ, जैसे कि हम ब्लो कर पाते हैं। अब ये सब चीजें जो हैं उनको बोलने में मदद करने वाली है, राइट। इट इज द व्हेन वी आर स्पीकिंग, हाउ वी स्पीकिंग, we blow out the air while we are speaking, right? So that blowing has to come. The tongue, the oral motor, the feeling of the mouth needs to be there, right? तो बच्चा, ये हमें कैसे पता चलता है कि बच्चा अपना खाना च्यू कर पा रहा है कि नहीं कर पा रहा, right? That's very important to see whether the child is able to feed on the food properly, right? That is a prerequisite. ठीक है, क्योंकि खाना भी मुंह से है, बोलना भी मुंह से है. Both the things have to be done by the mouth. Now, if the child is not able to chew the food, right? That means वो अपने अपने teeth का होने का अनुभव ही नहीं कर पा रहा. It's he or she is not feeling that he or she has teeth, right? अब उसको वो proper use नहीं कर पा रहा and the child is trying to swallow. ठीक है, ब्रश करने के बाद the child doesn't know how to spit. So while we are talking, we are actually blowing out, right? And so lot of muscles here need to be toned enough for the production of speech, isn't it? तो उसको स्पिट करना आना चाहिए, उसको ब्लो करना आना चाहिए और उसको chew करना आना चाहिए, उसको bite करना आना चाहिए. That if I give him an apple, he should be able to bite it, right? Now, this also is a prerequisite for the speech production, right? So, because Ranak had issues when it comes to feeding, and he would just swallow. I used to, purie his food and then present it to him, because when he was an infant or a toddler, he only knew how to swallow. He had zero oral motor skills when it comes to chewing, when it comes to biting, when it comes to rolling his tongue, right? Like when, you would have seen a lot of time that, the infant children or toddlers, they make a lot of, they make a lot of noises with their mouth. They will do, they'll play with their lips. All those things are so very important. And in our children, it goes missing, right? So too much, when the child has learned how to imitate or is able to see, even with, able to see not in your eyes, but at least is concentrating on your lips, lip movement, right? That also helps in production of speech, because now the child knows how to imitate the movement of the lip. And when we are teaching our children lip movement and we are sitting and teaching them, then it's nice to go very slow, right? Slow and exaggerated lip movement really helps. Okay, this really helped Rana. We got an app. It was for the apraxia of speech, okay, where we had only lips and the lips were making various sounds. And Ranak was somehow very amused with this app, right? So this app really taught him how to, articulate certain sounds which were difficult for him. And he learned it from the tablet. We had an iPad at that point in time, and he was trying to, imitate the lips. There was only lips on the screen, and this t, k. These were the sounds which were difficult for Ranak, because he was confusing between k and t, right? So all that articulation and everything, can be built up even with certain apps which work very beautifully when it comes to, they are like, an addition to our speech therapy. So it's very important that these prerequisites are met before there is a production of speech, right? Uh, the sitting capacity, the language development, the connection between the child, the oral motor skills being good, right? And then comes the role of the speech therapist, or or a device. We need to bring that some kind of a communication tool to bring down their anxiety and then work hard to get their speech. Now, speech, not only does, speech, yes, there is a communication and language delay in our children, the part of the brain that was to be developed, especially for communicating, especially for making that social bond, there the connections are going faulty for our children, right? Uh, how do we internally reach out to those places? Is it that our child faces certain deficiencies, and if we overcome those deficiencies, can our child improve when it comes to speech? And the answer is yes, right? Our brain is very much connected to our gut, okay? And for our children on the spectrum, generally there is an inflammation in the gut. There is an inflammation. This gut inflammation goes up in the brain as well. And there are many reasons why there is a inflammation in their gut. There can be, many reasons. And we generally understand in my masterclass what those reasons could be, why our children face gut inflammation. This gut inflammation goes back to the brain inflammation. And if we start dealing with the gut inflammation, we reduce the inflammation there and we increase the nutrient absorption of the gut. Does it affect the speech? Of course, it affects the speech. And I have seen firsthand with my child, I made all the dietary changes, cut down on inflammatory causing, foods that were causing inflammation and foods which were healing foods as well. So I introduced those healing foods and I could see Ranak, transition from non-verbal to verbal, and that verbal also was apraxia of speech. So he was not able to complete the word. So for push, he would say poo. So half of the word he is able to say, but he's trying to come up with the word. And you won't believe, because we were already on diet, we were already doing so many things to bring healing to his gut, because he was in a bad, pathetic state of chewing. He was in a pathetic state of sleep. He was, and then he had all the sensory issues, and all these issues were calmed down with the help of the diet. So diet played a very important role in our healing, in Ranak's healing. And so he graduated from, non-verbal to apraxia of speech to only articulation issue to no articulation issue, to a level where, yes, there were words which were difficult. We used to keep practicing, practice. That makes all the sense. Practice and he would get it. Practice and he would get it. Right? So, and the foundation was the nutrition. The foundation was gut healing. That's why we were not stuck at one level. We kept on graduating to a level where he was speaking very softly. He was verbal, but a lot of people wouldn't understand what he's talking. To a time when he is clear and loud now, right? So all these things have happened. Yes, we need a lot of patience, but there is a possibility, and there is 100% possibility, right? If we try to bring in a holistic approach to making our children from non-verbal to verbal, right? And communication is very important. It is more important than the production of speech, right? The child should be able to reach out to us and communicate his or her need, right? So it is basically more than words, right? So I hope you liked my session today, and keep in touch with me, keep joining me, and so I keep coming up with these kind of tips. I also hold a masterclass on Fridays, 5 p.m., where I deep dive into the intervention, which is very much a parent-led intervention of diet, detox, and nutrition that lays the foundation for our children's, well-being. And I also hold 14 days NeuroReset program, and we talk about it in our masterclass. You can join it. It's free of cost, so you can always join me, and I'll take it further, because that is what I give the main credit to Ranak, graduating from various levels, crossing the obstacles, the challenges, and reaching to where he is now. And we are still reaching new, we are achieving newer goals, and this will continue, right? So I want you to also have the similar journey where you keep crossing all your challenges with ease, with ease. So I want to make my program uh, in a way that you can easily transition your child on the spectrum without any hitch, without any doubt. And yes, let's never give up on our children, because the potential they hold is unbelievable. Yeah, they have immense potential. So keep in touch, keep joining me, and let's talk about more challenging topics like this, and keep empowering each other with these kind of topics. Bye bye for now. Meet you soon. Bye bye.